So thank you all so much for coming to our COVID meetup and check-in. Happy 2021. I hope that everyone's new year has been off to a good start. For today's agenda, we're going to go through the following topics. We're going to do our 3 deep breaths, and then we just have some Montana COVID updates, vaccine information, and general COVID news. So again, I've just kind of gone out and taken a look at some of the things of what's happening to give you an update and see if you all have any questions on what's happening. As a reminder, if you would like Aspen credit, this does give you 1 CE credit in library administration. Please put your full name and your library in the chat, and that way I can double check and make sure that you will get your credit and I add you to the list in Aspen. So yeah, let's go ahead and get started. So our first thing is our 3 deep breaths, and this is a picture of Yosemite. I think it's tunnel something from Yosemite. But I have a full national parks calendar, and the January's month is Yosemite, so I figured I'd share that all with you. But for your 3 deep breaths, if you can just sit up straight, bring your shoulders down, lift up your chest, and we will try and breathe deep into the bottom of your belly instead of just staying in your chest. So we'll start now, and inhale. Exhale. Inhale. Exhale. Inhale. And exhale. Perfect. And for some levity, if anyone wants to share anything fun or exciting that's happened in the new year so far, feel free to put that into the chat box and I'll make sure to read that out to people. My fun thing is that I went cross-country skiing in Highlight Canyon, which I'd never been to before, and it was a lot of fun, even though I'm not very good at cross-country skiing. So let's go ahead and move on to our first topic. I wanted to talk a little bit about some Montana COVID updates. Ooh, Demi says there was a roadrunner in our backyard. You know, I always forget that roadrunners are actually a real thing, because of all the cartoons. But anyway, there is an updated vaccination plan that I've linked here that talks a little bit more about the different phases of vaccination, who the target audiences are for each phase, as well as the general timeline for how long this phase will take. So I'm going to go through those. I have screenshots of the plan in the next few slides, but just letting you know that this is also a living document, so it is being changed, it is being updated, and all of these things are, of course, just estimates to the best of people's ability. But in case you're curious, there is a vaccination plan, and you can look at it on DPHHS's website. I also linked an article from the Montana Public Radio that's talking a little bit about the vaccine distribution phases, so you can read a little bit more about that. I've also looked at or linked the Helena Independent Record. I think Governor Gianforte, I did not actually attend the press conference, but he just held a press conference, which I've linked here on Facebook, and he announced his plans to lift the mask mandate in a matter of weeks instead of months. And so you can read a little bit more about that. He's waiting until, I believe, until the most vulnerable people have the opportunity to get vaccinated, and after the legislator has provided small businesses with lawsuit protections, I believe. So the Helena IR has the some details about that, and you can also look at the press conference from Gianforte, the recording of it, on Facebook as well. So we will go over some of the vaccination plans things here. And Jenny has said that there's actually been some changes, so she is happy to review those. And I'm glad, Jenny, that you're here to do that. But phase 1A is targeting the, frontline healthcare workers, long-term care workers, and that's what we're in right now. And we're hoping to do that through the middle of January. And so that's being distributed right now. And Jenny, I'm not sure where the changes are, so feel free to jump in whenever.
Sure.
So
they start with 1B.
With 1B, okay, cool.
Yeah.
So this is 1B. And
yeah.
Yeah.
So as Amelia said, the 1A distribution is ongoing right now, and some areas are having more success distributing the vaccination than others, but there's a real push to try to get those healthcare workers and other critical people vaccinated by the middle of this month. So within the next few days. And then the next group, what will be phase 1B, are persons over 70 and people 16 to 69 who have underlying health conditions. And information about what those health conditions are is being distributed today as well. So that will be phase 1B, people 70 and older, or 16 to 69 who have some predetermined underlying health conditions. So we'll look for what those conditions are and get that information shared as well. Governor Gianforte said he anticipates that number of people to be vaccinated would be between 250 and 300,000 people. So we're talking about a significant population to receive the vaccination in 1B. And they did not offer a timeline for when they think they will be able to accomplish that completing of that phase 1B. So that's information we'll be looking for as well. And so what that addition of that vulnerable population does to the rest of the vaccination plan is just push back those tiers into subsequent phases. So what was currently in phase 1B will now be 1C and so forth. And I don't know, Jennifer, that that's been made public yet, but Governor Gianforte said that document should come out today. So we're keeping our eye out for that. And we'll share that. The link to the press conference that Amelia shared is where Governor Gianforte outlined these changes to the vaccination.
Yes, and I did include a link to the version of the plan that I have screenshotted here. But if you look at link number 5 that I just dropped into the chat box, that's just the general COVID vaccination plan information page. So I imagine they would also upload the changes to the vaccination plan here. So as Jenny said, unclear when those changes are going to be uploaded, but I'm guessing if you look on this home page for the coronavirus vaccine for Montana, that they'll probably have that up there as well.
So to the question about whether or not libraries are going to be in what will be the 1C phase, I know of at least, and maybe we could keep it on the 1B slide, because this 1B group will be in the what will be the new 1C, this same group of frontline workers. What I know is that at least one county has said that their libraries fall in 1B. What I have asked for clarification from the state on is if that information is coming from the state mandate for all counties, or if that's a decision that's been made in that one county. And I'm waiting to get that information. So at this point, we know that at least one county has said their librarians will be eligible for the vaccine in what is now the 1C, what was the 1B phase. I hope that same guidance is coming from the state to all local governments, but I can't confirm that yet.
Awesome. Thanks, Jenny. And there's another comment from Heather saying, I was told library employees in Rosebud County are up for the vaccine next.
So that would be consistent with what I had heard from, it was Flathead County as well.
Awesome. Cool. Thanks, Jenny, for alerting us all to the changes in the plan. So maybe I won't go over this because it sounds like there have been changes, but as you can see, the general structure of the plan is, who's in what group, and when they're hoping to administer the first dose and the general timeline. Again, all of these things are estimates. They are subject to change. They do post at the bottom of the plan when it was last updated, so you can see how recent the changes are. But just to give us all a general idea of the vaccination plan and how things are going. And again, the link number 5 that I dropped into the chat box has all information about the coronavirus vaccine in Montana. So I would suggest bookmarking that and making sure you have that on hand. And Jennifer asked, people with high risk are in what phase? And I think that is now phase 1B.
That's
Jenny,
correct. Yep.
Yes.
Yep.
Okay. Phase 1B. And Starla asked, are the vaccinations going to be forced on us? I don't think so. In terms of the workplace conversation, I think that's still being sort of discussed in terms of what employers and employees can do or might do. But again, as you can see with phase, I mean, even regardless of where you are in the phases, the vaccines aren't even available at this point for a lot of people. So I would encourage you all to take a look at the vaccination page. There's a lot of really, really great information on there. Feel free to share this as well with the public because it links out to the CDC, it links out to the WHO, it links out to all of these authoritative, excellent sources on the coronavirus vaccine and questions that people might have. So I would recommend people to take a look at that. Oh, and this is just reiterating that. This is the same link that I included in link number 5. So for just some general COVID news, I have some articles here just to kind of see what was going on in the world and in the US. So let me actually go ahead and drop these into the chat box first. Let's see. Let me finish typing this out. Okay, so I've put all those links into the chat box. So the main thing is that, as you might have already seen, the UK variant of COVID has been discovered in 4 different states so far, I believe California, New York, Colorado, and Florida. And at this point, it's probably likely that it'll show up in other states as well. Again, while this variant is shown to be more contagious, there is no evidence yet that suggests it's more lethal or that it's resistant to the vaccine that Moderna and Pfizer and AstraZeneca have created. So obviously public health experts are monitoring things, looking at things, making sure that they're doing research on this new variant. But there has not been a need to adjust current safety precautions or methods that we already are currently employing. So people are still recommending social distancing and masks and limiting exposure or opportunities for potential exposure. The main concern is just the increase in hospitalizations because with a more contagious version of COVID, more people will be infected, which will probably increase the portion of people who contract a more lethal version of the disease. So you can read about that in some of these articles. Um, in the UK, in Europe, the UK is actually back on lockdown. I believe they started that in December sometime. And right now, I think they're talking about extending the lockdown and deciding on how much longer to have it in place for. And I think other European nations have banned travel from the UK starting in late December. So these bans are temporary, and I think some of them were lasting into the beginning of January, so about now, but I think some of them will be renewed. So there's some information about that. The New York Magazine article is a pretty good overview of current conversations around the new COVID strain. So I would highly recommend reading through there and clicking on the links that are referenced. It goes out into current research that's being done on the COVID strain, the new COVID strain, information from the CDC, and other organizations as well. So it's a pretty comprehensive look at all that we know currently of this new strain. And then also I included an article about Germany's lockdown, which started on the 16th, and it's set to expire on the 10th, but will probably also be extended. So, oh, sorry, my cat has just woken up. So this is just kind of a general, I guess, take on what's happening in the world. Yes, if you have any questions, feel free to put those into the chat box. But hopefully this will give you information that you might be curious about regarding the new strain. And actually, that's all the stuff that we had for today. I did want to again emphasize link number 5 that I included, DPHHS's website on the coronavirus vaccine. I know last time there were conversations about whether or not people should get the vaccine and why it is important. And so, you know, none of us are health experts, none of us are epidemiologists, but it is important for people to be getting information from reputable sources. And the DPHHS website is a great compilation of all of those resources in one place. I did also I was hoping to get someone from DPHHS to talk about the vaccine, but unfortunately they're quite busy at the moment and have been focusing their outreach and education efforts in other places. So they didn't have someone available to come and meet with us, but they did tell me a little bit more about why getting the vaccine is important. And they talked about how, people who don't get the vaccine can still carry the virus. And by carrying it, this is why we see things like the new strain coming from the UK. The more it lives in the host, the more likely it becomes something that will mutate in a way that can maybe at some point avoid antibodies produced by the vaccine. And that's called an escape variant. So in order to prevent that and to prevent more mutations, getting vaccinated is an important part of that. And also, nothing is 100%. Even the best, not just vaccines, everything in life, as we know, is not 100% effective. So in order to have the best odds with us, it's important for you to get the vaccine and also for the people around you to get the vaccine. So that improves your chances of not getting sick and also not getting lethally sick. So again, if you have questions about the vaccine, if you have patrons who have questions about the vaccine, please just make sure that you're directing them to reputable, authoritative sources. And the DPHHS website is a great place to start. Jennifer had a question. Do they know why the reaction because of the shellfish allergy? I have not read about that, so I am not sure. But maybe there's something on the DPHHS website or possibly on the CDC website, especially at this point where probably enough people have taken the vaccine where they can see kind of general patterns. I have read that a lot of people have reported kind of like a flu shot. There's general soreness at the site of injection, and it's like it feels a little bruised for a couple of days. but I haven't read anything about the shellfish allergy. So if anyone else knows anything about that, feel free to contribute. But Jennifer, I can also take a look at that and see what I can find for next time. And Starla says, I'm deathly allergic to vaccines. It's not worth the risk for me. And of course, everyone has to make sure that they do what's comfortable for them. And there's a lot of information out there, so you can do more reading on it. Yes, any other questions?
Amelia, I might just chime in a little bit with a little bit more detail on the mask mandate information. And again, I would encourage you to go out and listen to Gianforte's press conference. As Amelia said, he did make it clear that he plans to lift the mask mandate. And as she said, he's thinking weeks, not months. He said when he lifts the mandate will depend on how quickly they're able to get the vaccine out to that vulnerable population, and then adoption of legislation that protects businesses and schools and churches and other organizations from potential litigation. And he said he wants to develop incentives for businesses to incentivize certain behaviors. He didn't specify what those incentives might be or what those behaviors might be, but he talked a lot about those kinds of incentives. Those are the two measures that he's looking towards: distribution of the vaccine and passage of that kind of legislation. And once that's in place, it sounds like he intends to eliminate the mask mandate. He did emphasize that in the current state of emergency, local governments do have the ability to pass more restrictive mandates than what he might pass at the state level. And I know we're starting to see some communities already anticipating him lifting the mask mandate, passing their own more restrictive mandates and directives in their local communities. So just a little bit more information about what Gianforte shared in the press conference.
Awesome. Thanks, Jenny. And
Can
Governor
I ask a
Gianforte,
question?
oh, sorry, go on.
What happens if Biden passes a federal mandate? Does that trump counties and states?
I am not sure, but I think the way that it worked in Montana is that when Governor Bullock passed the mask mandate, local counties could pass things that were more restrictive, that were stricter, but they couldn't pass things that were less looser. I don't know, that's not the right way to phrase it. So I'm guessing that would be the same case if there were a federal mask mandate, but don't quote me on that. That might not be the case.
Well, I mean, it's just that he has said he would wants 100 days of masks, I believe.
Mm-hmm. Yeah, I'm not sure how that would interface with local policies, but
it might be a matter of having to look at what an actual executive order might look like, the specific language when something's drafted. Mm-hmm. But I suspect Amelia might be right.
Yes, that is my guess at the moment. I will do some research into that though and see if I can get a more definitive answer. And there are a couple more comments. Okay, Starla connected with Kara, and Jody said, I'm guessing some counties will continue with a local mask mandate. I believe so, and I think some counties have already passed something. I remember reading, I think in the Helena IR article. And I do know that Governor Gianforte said that he himself would continue to wear a mask and is planning on getting vaccinated as well. So I hope that sort of serves as an example for some people. But yeah. Whitefish did, and passed. Jennifer says that Whitefish passed a mask mandate. Jody said Carbon County has had a more restrictive mandate in place for months now, and Joe says tribal communities will probably keep restrictions in place as well. So yeah, there will probably be much more discussion once things start moving towards repealing the mask mandate and as local governments respond. So we'll of course keep you updated on that as it happens. Any other questions, comments? And Starless asked, has anyone done a carryover tax levy? I have not, so I do not have anything to contribute to this, but maybe someone else has.
That's a pretty complicated thing, Starla, that I talked to the Department of Administration about, and I would be happy to visit with you.
Perfect. Thanks, Tracy.
Yeah, you bet.
I'm just going to unmute and kind of let everybody know. Tracy knows because I've talked with her about this. Our county treasurer levied 15 mills instead of 25 mills for our fiscal year, which is about a $20,000 shortfall, which is crippling for our library, of course. Anybody in a small library knows that. So, of course, we've gone, due to COVID, we've gone through the year way ahead. And right now, the consensus between the town clerk and myself is to try and make it through to December of next year on what we have and the little bit that we'll receive. Just because it is pretty complicated from what I'm seeing, and it's going to mean a lot of man hours for both the county treasurer and the clerk and the town clerk to try and do a carryover in the way I understand it to go, because they want to do multiple years. They don't want to even just raise it next year. They want to do it multiple years. So I was just curious if anybody else had been through this. I know Plains was through it in the reverse. They were given too much money. But this is, well, it's a damned hard blow coming on the heels of COVID. You know, instead of looking at recovering in June and getting back to our programming and getting back to life, we're talking about shutting down to one employee for 12 months to try and make it through. So anyway, that brings everybody up to date on where we're at.
Thanks for sharing, Starla, and I'm sorry to hear that you guys are having to contend with all of this on top of, as you said, on top of COVID. So I hope that Tracy and you can possibly talk about I'm sorry, I don't even know what a carryover levy, tax levy is. But if anyone else has anything to contribute or has similar issues, feel free to also bring forth to the group and put it up for discussion.
Starla, this is Lori and Dylan. And what I have to do every year for our commissioners to give us our full mill levies is I have to go in and write them a letter and ask for the full mill levy and why we need it. Otherwise, they won't. They'll just give us whatever they think they can give us.
This was actually a typo made by the county or the county treasurer. So it's not actually the county trying to be dodgy. However, I don't want to start a precedence of dodginess either. there is never a year that I come out ahead in December. December, I'm waiting for that November tax check. This year is unique. And I don't want them to think that we could get by on 15 mills at a regular year, because there's no way. So no, our county's not being dodgy yet. It's just a failure to check things. And I do think, you know, I know that the courthouse has been closed on and off all fall. How the county treasurer has done her job in both places. Plus they decided that she'd be the county superintendent of schools, which is usually a cake job. That's usually nothing. This year, it's a nightmare for the school situation is a nightmare. So, you know, it's done. She owned up to it, but there's really not anything we can do. So.
There's been a couple of comments. Carolyn said our voted levy is for 8 years with a built-in cost of living increase. They have to give us the whole amount, no questions. Unfortunately, it's coming up in the next few years. And just to mention some of the other conversation happening in the chat, Jody had asked, I'm wondering whether other libraries are in terms, where other libraries are in terms of quarantining returned materials. Do you still have a quarantine in place? Have you decreased the length? Michelle in West Yellowstone said, we're still quarantining all materials for 3 days. Whitney also asked, how are you planning for summer reading with so much up in the air due to COVID? Jennifer from Imagine If said, we're talking about doing an adventure kit. Valir is planning outdoor activities. And as for an adventure kit, it's take-home activities that they just, so like, I guess like a packet or, you know, kits that people can take home and do. And they just started talking, so not all the details are yet forthcoming. And Gail said that Belgrade quarantined 7 days. And back to the summer reading program question, I think at least with CSLP discussions, most people have been planning for virtual programming or outdoor programming. And using that as the default. And then if they need to, and things are better by the summer, they can easily switch things into in-person. But I think the switch is easier to do from virtual to in-person as opposed to planning for in-person and then switching to virtual. So obviously you know, your library will know what's best, but that is the sort of general consensus I've heard from other libraries that have been planning across the country, where they've encouraged people to plan for virtual stuff, and then if need to, they can switch to in-person. For quarantine periods, Dylan is quarantining for 3 days. Carla says at least 3 days. Magazines are 2 weeks. Planes is 3 days. Lori says for summer reading, we do outdoor activities. You can call her and she'll explain how we do it. It'll be the same as last summer. And Blaine quarantines for 3 days as well. And just to let you know, we are planning on starting with summer reading brainstorming sessions. There's actually going to be a summer reading workshop with Sherry Norfolk, who is a storyteller, and she has a virtual summer reading programming planning session scheduled with us in late January. So anyone is welcome to come to that. She has some really great ideas. And then we'll also just have some general summer reading planning sessions for people to just come and discuss and ask questions and share. So be on the lookout for those. I'm hoping to do at least one sort of summer reading session each month. Val says we will probably do story walks again. They were very successful last summer. And yeah, I think there were a few libraries in Montana that were doing those. And Pam just shared American Libraries had recent Realm results, which, if you all remember, is the reopening archives, libraries, and museums and testing how long COVID stays on various library materials. So you can take a look at that, those test results, and look at those there. And I'm actually going to go ahead and stop sharing my screen because I just realized you guys have been looking at a black screen this whole time. I'm sorry. And Heather said we quit quarantining based on the realm results. Let's see. Any other questions? Joe says, for your information, here on the Blackfeet Reservation, the COVID Incident Command has been giving out gas gift cards to those that get tested at their regularly scheduled drive-in testing sites. I expect similar incentives to encourage people to get vaccinated. Oh, I had not heard of that, Joe. Thanks for sharing. So that might be a strategy people employ. Yes, Heather says that is so smart. Any other questions? Comments? Concerns?
This is Joe. I just want to invite everybody to the website chat on Friday. Jenny is at the beginning of our legislative session. She always has a lot of really good information to share. And I know some of you, we heard from someone that it would be really great to have to know how to research legislative issues as they run through the legislature. So Jenny, I hope you'll run through that again on Friday. It's always, it's getting easier and easier to do that, but it is really important. I think librarians know how, because things have changed a little bit this year. So hopefully we'll see you at noon, or maybe you can catch the recording on that.
There's another comment. Val says, as someone who had COVID and is still having long-term effects, I will definitely be in line for the vaccine when my turn comes. Yeah, I'm glad you're feeling better, Val. I hope that your long-term effects go away soon. Any other questions? Okay, well, I think at this point, if there's no other questions, we might go ahead and stop the recording. Just to let you know, the next meetup will be January 19th. That's a Tuesday, again, from 3 to 4 p.m. And, we'll be sure to take a look at these topics again, see what's happening with general COVID news and Montana COVID information. And I'll also research how a federal policy might interact with state or local county policies. I'll look more into the workplace vaccination conversations that are happening. There's one more thing. Oh, the shellfish allergy with the COVID vaccine, and see what might be going on there. Feel free to reach out to me anytime as well if you have other questions. Also, feel free to reach out to, I was very surprised, but if you reach out to the COVID-19 folks at DPHHS, they're very responsive. I had sent them a question and I thought that they wouldn't get back to me for a while, but they got back within the day. So I would encourage you to reach out to them directly with any questions or concerns that you might have, because especially from them, you're getting it directly from the source. Jennifer asked the email for them. I think it's covid19@mt.gov, but if you go to covid19.mt.gov, there's like a contact us thing. I think I just clicked on that. And I'll try and look that up later, Jennifer, and send that to you to make sure. But their email is definitely listed on the COVID-19 website for Montana. All right, let me go ahead and I will stop the recording. As a reminder, you can